This podcast does not provide medical advice. Please listen to the complete disclosure at the end of the recording.
Hello, everyone, and welcome to Everyone Dies, the podcast. I'm Marianne Matzo.
And I'm Charlie Navarrete.
Please grab your beverage of choice, something to to snack on, and thank you for spending the next hour with us as we talk about the film The Leisure Seeker. In the second half, I'm going to talk about some new research reports that you can consider to improve your health. In our third half, we're going to have another episode of Funeral Theater with us, where we put the fun in funeral and a scene from The Leisure Seeker. Our recipe this week is Methodist potato recipe. And please note, if you refuse to cook with cornflakes, don't make this recipe.
Okay, hey, let me write that down. I'm going to make a note of that. Now, would that also include like Frosted Flakes, or just anything related to the flake industry?
I don't. There must be a recipe with Frosted Flakes, but I can't think of one. This is regular Frosted Flakes with potatoes and butter. I mean, what could be better? What would be the problem?
So corn flakes, Frosted Flakes. What about snowflakes?
Nope, not.
No,
this is
snowflakes. Okay.
This is Methodist potatoes from the South, so I don't think that there'd be much.
Many snowflakes
for them to work with.
Okay. All right.
Yeah.
All right. Let me write that down too. Then let's say, okay. All right. Very good then. So, listen, Marianne, from our mailbag.
Special delivery.
We got our first fan letter. It's not a fan letter, but we got a letter.
Huzzah! This is from Shaban, who writes, "For your upcoming talk about euthanasia, I have a talking point suggestion. I saw a movie last year that involves dementia and euthanasia, The Leisure Seeker. Donald Sutherland has Alzheimer's and his wife is played by Helen Mirren. They are traveling in their RV for the last time. She's not good at handling his memory problems. Skipping some sad stuff, at the end she arranges the RV to fill with CO while they are sleeping, thus killing both of them. If I recall, she doesn't even ask him what he wants or how he wants to die. So I was upset. I was so upset about what she did. It would have been different if they were both depressed about their situation, but that's still a depressing story. I can't recommend the movie, but the end is an important subject to discuss."
She's right.
Yeah. Well, Siobhan, we are going to do just that. And in addition to that, about, there was pretty much, the wife's decision and didn't discuss it with her husband. There was a disturbing article in the paper I read. We're here, of course, we always advocate for people to take care of their advanced care directives, your healthcare proxy, living will, etc. And, I live in New York, which is very clear laws about if you have a healthcare proxy, the doctors, nurses, healthcare provider, etc., must follow that healthcare proxy. Well, guess what's happening? What's not happening in New York, not only here, but across America? Many times doctors are just disobeying an advanced care directive. And like I said, here in New York, it's rigidly enforced. Other states, not as strong, but again, as we always say about advocating for yourself, please, 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 please do not let some doctor, nurse, etc. bully you out of your decision of how you want your life to end. Doctors, God bless them, but, this idea that, I can keep this person alive, not if you don't want to. If you are in very bad shape, you don't want to be intubated, you have a do not resuscitate order, etc., that needs to be followed through by your doctor. It's become a big enough problem that some families now are actually suing doctors and hospitals because they refuse to follow the healthcare proxy. And even when the person advocating for the person who's dying is there and saying, no, 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 that's not what my friend wants, that's not what my parents want, etc. Sometimes doctors are not listening or trying to talk them out of it. So the bottom line is, please be aware of this.
So are doctors doing this of their own volition, or is there another family member who has their ear and saying, I don't care what's written down and I don't care what she says, I want you to do what I'm saying?
Mostly of their own volition. There in the article, I think they mentioned a couple of circumstances where a situation was like that, where either there were two people on the healthcare proxy, and then one changed his or her mind, or it told me one person on the healthcare proxy, and then another family member or a friend says, no, 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 let's not do that. And doctors then hear that and say, oh, well, then, if you can't make up your mind, I can keep this person alive. And just take advantage of,
Well, it's not, in that situation, It's not a matter of taking advantage of anything. The issue is that once you extubate them and that person dies, there's not a do-over. Whatever you've done, that's what's going to happen.
Right.
And so because it's a matter of life or death, a physician in that situation is not going to put themselves in that kind of, well, he wants it, she doesn't, because those two people are going to be alive at the end of all of this. And if they want to then take that doctor to court, they can. And so, being a very litigious society, physicians are not going to get themselves in the middle of, this person made you their proxy, and now one of you is changing your mind and saying you're not going to do what he or she asked you to do. They're just not going to get in the middle of that, because that's a lawsuit. Your situation where you're saying that the doctor on their own is changing their mind or not following it, then it makes me wonder again, is it because they're not terminal? What's the situation? Because I've worked in these environments for a long time, and usually after a family meeting and bringing out the advance directive, the physician may not like the decision, but they'll follow the decision.
And this is what the article is saying, is that too many times the doctor is not following.
Right, I get that.
Yeah.
But what I'm saying is, I want to know. I want to know why. And I'll tell you, I've been saying for 20 years that until somebody starts to sue, the physician's afraid that somebody in the family is going to sue them for allowing the person to die or taking them off the ventilator because these people are alive, and they can say, okay, I'm going to sue you. I've been saying for 20 years, until somebody sues them for not doing what the advance directive says, does the whole thing change? So that's why I'm just curious about that, the physicians going all, rogue and just doing what they want. That's not been my experience in hospitals, but
what this I'll send you the article. What the article is basically saying, there's an increase in that. Physicians, regardless of what's on the proxy, physicians just not following it. And as a result, now, and again, it's not a tidal wave, but now there have been lawsuits against doctors and against hospitals for not following what was on the proxy.
Well, to that I say good.
Yeah.
Because why have healthcare proxy if people are not going to follow it? But I'm just curious about more of the backstory as to what motivated them not to do what the patient requested. And I don't know that we'll get that answer out of the newspaper article,
Well, it intimates that a lot of just, and again, maybe it's just my spin on it, but I don't think so, that sometimes it's just the doctor's ego. Because as a doctor, that he or she knows better, and regardless of what's on the proxy.
I don't know.
Yeah.
How does that fit in with this film?
Well, like it says that, Siobhan said, that there was no discussion between. I'm going to put it, that she made the decision for both her and her husband. That Helen Mirren made the decision for both her and Donald Sutherland, so that. I mean, in the exact correlation to this article, it's not. But just because there was not a discussion with, she didn't have a discussion with him. But I did not see the movie, but you saw it, and you said there was a scene in there that where there had been.
Yeah, there's a scene where he's talking. They have this like rinky-tink gun that they keep in the camper, and he says to her, if I get to the point of, I forget how he puts it, but where he can't remember anything, he said, take this gun, put it in my mouth, put my thumb on the trigger, tell me that I said this is what I wanted, tell me what to do, and walk away so I can pull the trigger and end it. So he clearly says, I don't want to live like this. Mm-hmm. And she's also terminally ill. She's full of cancer and just in very, very, very bad shape herself. And she didn't feel like she could leave him. She was afraid that, I guess, he'd be in a nursing home, right, and he'd be so confused without her. And she just thought, it would be better if we're just together.
Okay. Yeah.
But I thought it was a good film, not always accurate, because they have him driving this big old camper from Massachusetts to Florida, and I thought, oh Lord, that that ain't never going to happen.
Yeah.
So I mean, there was a little poetic license throughout this film. But it was very sweet at one time. It was very true at some times, and sometimes a little bit made for television or the movies, whatever.
Made for the hankies.
Yeah.
Okay. So, like Marianne said, we'll have a scene of that in the third half of our episode. So, please go to everyonedies.org. That's dies.org for additional resources. We appreciate your questions and anything else you want to tell us. Remember, the FCC is listening. You can email us at mail@everyonedies.org. And again, the number 1, please. Or please join our Facebook group, Everyone Dies. With Everyone Dies on Facebook, you need to spell out the word everyone. So Everyone Dies. And please remember to rate and review this podcast. Molly, that ball of fire, our Twitter correspondent, is hoping you will follow us on Twitter and repost her tweets so that we can stop making up names for her.
I know. Maybe that'd be so nice.
Keep making up names for her anyways.
So Charlie,
yes.
back in 1976, I was living in, had I moved to, no, I hadn't moved to Massachusetts yet. I moved there in, 78? 79. And they were starting a nurses' health study. I don't know if your listeners have ever heard of it. But it's started out as this kind of small thing, and it's really continued to grow, and we're learning a lot from it. So the Nurses' Health Study was a large, important prospective investigation into the risk factors of major chronic diseases in women. So a prospective study, Charlie, is where the participants are identified and then they're followed in time.
Mm-hmm.
So I was a, 22, 23-year-old nurse in Massachusetts when I was recruited to be in the study.
Oh.
And all the participants are female registered nurses. Okay. So once you were identified and you're in the study, then they've been following me for almost 40 years.
Wow. Okay.
So it was established in 1976 through Harvard. Funding was from the National Institute of Health, and the primary motivation was to investigate the potential long-term consequences of the use of oral contraceptives. Remember, back in 1976, oral contraceptives were a relatively new thing, and who knew what was going to happen if you took them for a long time. Registered nurses were selected to be followed prospectively, and it was anticipated that because of their nursing education, they would be able to respond with a high degree of accuracy to brief, technically worded questionnaires and would be motivated to participate in a long-term study. Married registered nurses who were ages 30 to 55 in 1976 and who lived in the 11 most populous states and whose nursing boards agreed to supply the study with their members' names and addresses were enrolled. And then every 2 years, cohort members, that group of nurses, received a follow-up questionnaire with questions about diseases, health-related topics, including smoking, hormone use, menopausal status. And the study has followed 121 female registered nurses. And then they started following our kids. If we agreed, they would follow our kids. So they're on their, I think it's like a third cohort. And then every year or twice a year, they come out with a report talking about, here's what we found from these interviews with these nurses. And so Charlie and I are going to give you some of those reports. So the first one I'm going to do is on fats, carbohydrates, and health. The high-fat, low-carbohydrate ketogenic diet, also known as keto, is one of the most trending diets these days. The general principle of this diet is to limit carbohydrate-rich foods like grains, pasta, starchy foods in favor of fat-rich foods, which totally genetically and culturally leaves me out because I'm Italian, and what would I do without pasta and grains?
Hello, yeah, exactly.
Right? It's like you just might as well take me out in the field because that's just something I can't do. I mean, I could, but it's just I'm not genetically programmed.
Yeah, exactly. Yeah.
So its ability to induce weight loss in the short term explains why it's so popular. However, the long-term effects of the diet have had very little study. So, in 2018, researchers pulled data from 7 multinational prospective studies, including the Nurses' Health Study, to evaluate the association of carbohydrate intake and the risk of mortality. So remember, the keto diet is like fat, and what this study is looking at is carbohydrate intake and the risk of mortality. They found that the association between a low carbohydrate diet and the mortality risk varied by the kind of fats which replace carbohydrates. So, low carbohydrate diets with mostly animal-derived fat sources like red meat and butter were associated with a higher mortality, whereas those with a more plant-based fat intake, like vegetables, nuts, and whole grains, were associated with a lower mortality. So anyone following a keto diet should be thinking about the fat types they're eating and emphasize plant-based fats. Just as the quality of fat is important, so too is just because, what's wrong with me? Just as the quality of fat is important, so too is the quality of carbohydrates. Replacing highly processed carbohydrates like refined grains, potato products, sugars, cornflakes, with unprocessed carbohydrates like non-starchy vegetables, whole fruits, beans, minimally processed grains provides health benefits. So what they're finding is that current evidence indicates that no specific carbohydrate to fat ratio in the diet is best. Instead, it's the quality of the fats and carbohydrates that's important.
Okay.
And Charlie, I've been saying that my whole damn life.
So you have your good fats and your bad fats. Kind of like the Wizard of Oz. You have your good witch and your bad witch.
No, it's sort of like quality. It's in men. Maybe you have high quality men and low quality. I don't know. I'm probably going to be in trouble for saying that.
Oh, that's okay. That's why we have a Twitter account.
Yeah. So do you have a report for us?
About high quality men and low quality men?
No, I don't want to hear about your love life.
Okay. Yes, I do. So with, and again, sugar sweetened beverages and how they affect your health. Yeah, these bad boys, sugar sweetened beverages, also known as SSBs, including carbonated, non-carbonated soft drinks, fruit drinks, and sport drinks are the largest source of added sugar in the diet. Although consumption of SSBs in the U.S. has decreased in recent years, more than half of the population still consumes at least one SSB a day. Typically like a 12-ounce serving of soda. And something like that contains 100 to 140 to about 150 calories and approximately 35 to 37 grams of sugar, which is close.
Jesus.
Yeah, I know. It's nuts. And I know you pointed out to me a while ago just about looking at labels, which I ignored. But at some point, I don't know what it was.
Story of my life with you.
But for some odd reason, in the store, and it wasn't a pack of cookies. It was some sort of juice, but but not like some sweetened, ultra high sugar thing you would think, and but it might even been like some sort of like supposedly like vegetable type of juice. I don't remember, but I looked at the back of it and it's like, holy moly! I was just surprised at the amount of sugar in it. Mm-hmm. And then I just started looking at other things, even like crackers. Some crackers just had, I'm thinking, well, they're crackers. A little cheese on it, I'm good to go. No, some of them still had just a tremendous amount of sugar in it.
I used to see a dietitian who used to say that Ritz crackers are not crackers, they're cookies, given the amount of sugar in them.
I love Ritz crackers with some peanut butter.
That's why we have problems, Charles.
I don't do that as much as I used to. But, yeah, really, that's just, it was that juice. I was just surprised. I said, no, this is, because the packaging just presented itself as something healthy, but oh no, not at all. So there you are. Something to keep in mind. Look at some of those labels and just get that idea in your head, like just the amount of sugar in everything. Can of soda, I understand, but Marianne, everything.
I know.
It's nuts.
That's why you read labels. If the first thing is sugar, then you're screwed.
Yeah. It's nuts.
Unless it's a bag of sugar.
What?
A bag of sugar, the first ingredient's going to be sugar.
Right.
Well, then That's okay, because you know that you're buying sugar.
Oh, I see. It's not that's something just tucked into the label of ingredients, but you actually know. Okay, I see what you're saying. All right, very good.
He's my slow child.
Huh? And speaking of which, the old Domino Sugar Factory. It's crazy to think how many. You have no idea, like the different type of factories that used to be in New York City. Domino Sugar, huge sugar factory on the East River for decades. Sugar would come up from Central America here. So huge factory. It closed down, I don't know, maybe like 10 years ago. As with everything being renovated into like condos or lofts or something like that.
It's a sweet place to live, Charles.
Yeah. You seen the rents? No. So heading back to this. So again, a can of soda, roughly 35 to 37 grams of sugar, which is close to the recommended daily limit for all added sugar according to the dietary guidelines for Americans of no more than 10% of total calories. So, over recent weekend, and furthermore, over recent decades, research from the Nurses' Health Studies has provided strong and consistent scientific evidence linking intake of SSBs with long-term weight gain and risk of type 2 diabetes, coronary heart disease, and other cardiometabolic conditions. Most recently, they showed that SBBs also contribute to a higher risk of premature death. Higher intake of SSBs was associated with higher risk of death from any cause, with a stronger association among women than men. Compared with drinking...
What else is there?
Mm-hmm.
If it's women and men, do we have a third category?
Yeah, better not go there. So, compared with drinking SSBs less than once per month, drinking 2 or more SSBs per day was linked with a 20% higher risk. The association was particularly strong for death from cardiovascular disease, with a modest increase for death from cancer, mostly due to colon and breast cancer. So, these recent findings built on the SSB research, where they found that women who increased their SSB consumption and then maintained a high level of intake gained about 17 pounds, while women who decreased their intake and then maintained a low level of intake gained only about 6 pounds. 2 subsequent analyses in the 3 cohorts provided additional evidence for a link between SSB intake and long-term weight gain.
So, bottom line, stay away from those high sugary drinks. Read your labels.
Yeah, those are the things. Yeah,
make better choices.
Yeah, don't just assume, oh, I'm not having a soda, so it's okay. Read those labels. That's your homework assignment, folks. Look at those labels, and then also you get to practice reading. So you kill 2 birds with 1 stone.
Excellent.
Yes.
So my next topic is on vitamin D and colon cancer. People living in southern regions of the United States have lower rates of colorectal cancer than people who live in northern areas. Because exposure of the skin to the sun produces vitamin A, it's thought that higher circulating vitamin D might be protective against colon cancers. Within the Nurses' Health Study, they've conducted numerous studies using different methods of assessing vitamin D status, including measuring blood levels, assessing the amount consumed by diet and supplements, and an integrated measure of different vitamin D exposures. The overall finding of these studies all support a beneficial association between higher vitamin D levels and lower risk of colorectal cancer. However, these colorectal cancers develop slowly over time, and this apparent benefit may take a decade or more to manifest. Moreover, they found that the benefit of vitamin D may depend on the local tumor immune environment, and the benefits could be specific to certain subtypes of colorectal cancers. So what they're saying there is not all colorectal cancers are the same tissue type, and so vitamin D may affect some tissue types, differently than others. These findings suggest that the potential protection of vitamin D in colorectal cancer may involve the immune system. In addition, in the Nurses' Health Study, there's also a suggestion that the benefit of vitamin D may also extend to later stages of cancer progression. Women with high vitamin D levels prior to the diagnosis of colorectal cancer demonstrate substantially better survival after cancer diagnosis than those with the low vitamin D levels. And similar findings have been observed in other studies. And when I was working in oncology, I always check vitamin D levels on my patients. And, the regular normal level, I want to say, is somewhere around like 45, 50. And we would keep our patients up around, I want to say 75 to 90, because it's been found that the higher levels offer more protection. And this was in breast cancer also. And we've found this winter with COVID-19 that people who had better, higher vitamin D levels also seemed to have some level of protection. So vitamin D is your friend. Don't be out in the sun without sunscreen. You can take over-the-counter vitamin D supplements. You can ask your doctor for high-dose vitamin D supplements. Those are prescription only. So when you go to the doctor, your yearly physical, if the doctor isn't checking, or the nurse practitioner is not checking for vitamin D levels, ask them to. It's important.
Very good. Sound advice. It's delightful. It's delicious. It's lovely. Yes.
So you got one more for us,
Yes,
Charles?
I'm going to add my 2 cents now. Coffee has received much scrutiny regarding its potential health effects, good and bad. Many studies have been conducted, including in the Nurses' Health Study, and the verdict is now clear. Overall, coffee appears beneficial for health, probably especially Irish coffee. Remarkably, coffee has been associated with lower risks of diabetes, heart disease, gallstones, Parkinson's disease, and some cancers, including liver and endometrial cancers. Marianne, this word, endometrial, am I pronouncing it correctly?
Yes, that's the lining of your uterus. Not my uterus.
But, okay. All right.
But a uterus.
A uterus, very good. Because my uterus is named Bob. Bob, that's the name.
Bob the uterus.
Bob the uterus, yes.
Mm-hmm.
But I digress.
No, Charlie,
Yes.
you never digress.
Yes.
Come on, don't kid a kidder.
So moving on. Those types of cancers, as well as, surviving from colorectal cancer as well. So these benefits are mostly not related to caffeine and are similar for regular and decaffeinated coffee. All of these effects add up to a lower total mortality rate in coffee drinkers. In the Nurses' Health Study, they recently published that coffee intake is associated with a healthier biomarker profile for inflammation, metabolic health, and hormones, which may contribute to coffee's health effects. Despite this evidence, in 2018, California proposed to issue warning labels for coffee products based on the presumed carcinogenicity of acrylamide. Well, this bad boy is a chemical found in coffee that is formed when the beans are roasted. This concern was based largely on extremely high doses given to rodents, like Mickey and Minnie, I assume. Data, and of course, Pizza Rat in the subway system here in New York. Pizza Rat. Mm-hmm. Data from the Nurses' Health Study indicate that higher intake or blood levels of acrylamide. What?
I think it's mide.
It is mide, right? Yeah.
I think so.
Acrylamide, even in frequent coffee consumers, appear to be safe. Recently, California reversed its plan for warning labels. The end.
That is excellent news, Charles.
Yes, it is.
And so, Siobhan, for writing to us.
My God, how much coffee have you had?
Obviously not enough. For writing to us, we're going to do a little bit of a scene from The Leisure Seekers. And last night after I wrote the script, I said, David, we've got to watch The Pleasure Seekers. So he, goes through the thing, and this movie with Anne Margaret comes on, and I said, I really don't think this is right.
Well, you did say Pleasure Seekers, Anne Margaret, so there you are, yes.
Yeah, so be not confused. It's The Leisure Seekers. And this scene that Charlie and I are going to do is right toward the end of the film. And Donald Sutherland is the husband who's having memory issues. And he's kind of blurring the lines between his wife and his former lover, who is their neighbor for many, many years, and who the wife never knew about. So, Charlie, do you want to be the wife or Donald Sutherland?
I've always had a big thing for Helen Mirren, but I don't want to insult her or anybody else. So I'll play the Donald Sutherland part, and you play the Helen Mirren part, and so that there's no confusion. So Helen Mirren's name in the movie is Ella. The neighbor Marianne mentioned, her name is Lillian.
Right.
Okay, so please remember that Donald Sutherland is going in and out of reality because of his Alzheimer's.
And in this scene, he's back about 30 years ago.
Yeah, sorry. Yeah, exactly. So he's thinking back about 30 years ago.
All right, you ready?
Ready, Freddie.
Siobhan, this is for you. Darling, no, don't stop. Let's just find the campsite, okay?
Okay, I'm so tired.
If you're hungry, there's some food in the fridge.
You still don't feel right, Lily?
Don't fret, please. I won't leave you on your own.
Lillian, I'll go home and you feel okay. So...
Where's Ella now?
Ella? Ella's at home. At home? This baby's taking his toll on her. What am I thinking? I should be there to help her. I really have to go now.
Oh, wait, John, does Ella know about us?
Shh, no, she doesn't. I couldn't bear it if she knew, and neither could you. It would break her heart, and break mine too. We have to stop this, Lillian. Yes, yep, we have to stop this.
It's been going for a long time?
Way too long.
So, how long is too long?
You don't remember, Lillian? That was nearly 2 years ago, so...
Do you love me?
What are you talking about? You know it's not like that. You said it yourself. This is just between friends. You are a wonderful friend, Lillian. The best. But I love Ella. Ella is the love of my life. She's everything to me. And we've got a baby on the way, for God's sake. We have to stop this, Lillian. I'm sorry, but we have to end this once and for all. Goodbye, Lillian. Goodbye.
You get back here, you son of a bitch. You get back here. I'm going to kill you.
Ella? Ella, what's happening?
So, and that's the end of our scene. And what happens there is she is completely irate, calls a cab, puts him in it, and takes him to a nursing home and tells him he can just go live in the nursing home, and leaves and goes back to the camper and just gets drunk. And I don't know if she's, it's a part of his betrayal. It's a part of her betrayal because Lillian is their friend, their family friend. They did things together all the time. It's, I don't know, maybe feeling kind of stupid for not having noticed it or knew about it.
Yeah, probably, that stupid, angry, hurt, just, all rolled up into one.
Because she's taking care of him puts up with a lot, and I'm sure she must feel so violated to learn about this. And he doesn't even know he's telling her. Yeah. She's kind of wily enough to get the sense that he's not really talking to her, that he's talking to somebody else. And so she gets the truth out of him after all these years. Yeah. It's kind of a sad finding at the end of life, at the end of their life together anyway.
Yep. So with that, thank you for listening, everyone. Please stay tuned for future episodes of Everyone Dies. Our thanks to our executive producer, Major General Retired David Gillette, our producer Sandy, John, our technical advisor, Tom Hartman, our administrative advisor, Molly, our Twitter correspondent, and our friends, family, and our loyal listeners who are supporting our work at Everyone Dies. This is Charlie Navarrete.
And I'm Marianne Matzo, and we look forward to talking to you soon. Remember, every day is a gift.
This podcast does not provide medical advice. All discussion on this podcast, such as treatments, dosages, outcomes, charts, patient profiles, advice, messages, and any other discussion are for informational purposes only and are not a substitute for professional medical advice or treatment. Always seek the advice of your primary care practitioner or other qualified health providers with any questions that you may have regarding your health. Never disregard professional medical advice or delay in seeking it because of something you have heard from this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Everyone Dies does not recommend or endorse any specific tests, practitioners, products, procedures, opinions, or other information that may be mentioned in this podcast. Reliance on any information provided in this podcast by persons appearing on this podcast at the invitation of Everyone Dies or by other members is solely at your own risk.